Oh,
Hello.
welcome.
Thank you.
Yeah, so you joined us before during the virtual Disrupt.
Indeed.
But this is your first time at the in-person. Everyone's beautiful, smiling faces.
It's so nice.
One thing Jordan mentioned there is, unicorn company. I think many times over now, right? I don't know the valuation. Last time I saw, I think it was 5.7 billion.
Thereabouts in 2021 dollars, so,
Right. Right.
factor that all in.
Yeah, and you've raised nearly $1 billion now,
Correct.
right?
That's right.
And amazing success story for a health tech company. How did you do that? It's probably a long answer, but like, how did you honestly figure out like you could provide the kind of services that Cityblock provides in a way that is economically feasible and that payers and insurers will accept?
So we are a primary care, behavioral health, and social care company focused on low-income, marginalized populations, predominantly people who receive their insurance through Medicaid, or people who get Medicaid and Medicare. So they have disabilities, as well as being low income, or these are folks who are frail seniors, typically, living at home in marginalized settings. And the reality is that our typical healthcare system just doesn't do a really good job of caring for these folks.
Right.
It's transactional. It doesn't engender trust. It doesn't really foster longitudinal care and access to care. And when, for so many people, as it does, the chronic compounding impact of lack of access to education, to food, to warm, safe places to sleep, to social supports, add to all of the risk factors for worsening chronic conditions, physical health and behavioral health. It's always crisis, and it's expensive. And it doesn't actually solve the problem. And so when we looked at our model and looked at the segment of the population we really wanted to impact, and so when you put together sort of the market forces, a recognition that there's a failure, frankly, in the delivery system, and there's a care model that can find people, meet them in their homes, in the community, provide proactive, preventative care across physical, behavioral, and social needs, close gaps, and prevent people from having to go to the hospital in the first place. It was like imminently obvious that we could monetize that, right? And create a scale business that actually does things differently and solves a real problem for every single one of us. It impacts everybody in some way, shape, or form.
It seems so heartless and cruel, but I mean, the medical system is nothing if not heartless and cruel.
It does break your heart over and over again, that's for sure. And I think that's why it's so important to both, I come to this work, I'm a physician, I'm deeply passionate about caring for underserved communities. I come to this work from a place of real heart. This is my life's work, right?
Yeah.
And my mission. And I'm also a deep pragmatist, and I recognize that there are real economic forces that drive most of the decisions that people make in our healthcare system, certainly in the for-profit space, but also, as we read and learn more about, even in the sort of not-for-profit space, it's entirely P&L driven. And so part of what the sort of magic, I think, of Cityblock is that we have an opportunity to align what's right for humans, what I believe is moral and good, what addresses systemic issues like health disparities, with a business imperative. And for these payers, there's a real business opportunity here. There's a problem they need solved, irrespective of where your sort of mission and passion is.
How hard is it for you to stand up a new market, and how much kind of like upfront work is involved, and then what's the steady state after that?
Yeah, it takes a ton of upfront work. You've got to align a lot of things. We have to have the right policy environment that supports the type of care that we provide. There needs to be need, right? We go to communities, we try to really be humble about the way that we enter into markets. We look to see places where there are socioeconomic disparities, where there are health disparities, where there are access gaps, where we really think we can make a difference. And then we look for partners, payers, health insurers, who we can launch into markets with. And that takes some time. And then pre-launch, we spend the time, figuring out where exactly in the neighborhood should we be. Can we be near, the public transportation, near grocery stores, making sure that we're really mapping the ecosystem and showing up in places that are accessible to our members, and also positioning ourselves so we can go to the home and see people from there.
Yeah, right. Especially like you said, like if you're there for good, right? So if something goes away, but when doesn't that add a lot of like variability and unpredictability of the model, or can you kind of build that into the upfront cost? Because especially now, let's say we're going into a recession probably, right? Like I imagine that's going to get worse in a lot of cases. A lot of the funding is going to disappear from many of these organizations. How do you build that into kind of your long-term plan?
Yeah, it is a complex business, no doubt. And part of the beauty of it is that we have capitation. We have these sort of resources per member per month that we're accountable for managing, and we can invest as we believe they need on a population basis to make sure that we close the gap for people. You talked about the recession though, and just the economic downturn and the impact that's having on people. It's gonna be really interesting to see. I think more than anything, this moment in time calls for businesses like ours that are addressing folks who would get left behind otherwise. We know that the need for social supports is going to increase and has already increased. We've seen over the pandemic, through the public health emergency, the number of people on Medicaid increase. And so all of that creates for us more opportunity to prove our model.
How do you bring tech into it? Because we talked a lot about already how high touch you are, right? And you'll go to people and you're in the communities. So what efficiencies is tech providing, and why is that an essential part of the model?
Yeah, it's key. So tech plays a number of roles for our business. The first is in data. Understanding what to do for whom, in sort of what dose even, is really nuanced and really important. It's a great application for data science, and a really, really useful application for the technology tools that we've built in-house to direct our team. So I have a population of individuals that includes some young folks, some older folks, some folks with disabilities, some folks with mental health challenges. I have to engage all of them.
I think you're doing a great job, and thanks very much for being here with us and coming out to Disrupt.
Thank you for having me. I always love talking with you.
Yeah, it's great. It's great. We're actually buddies.
We are really buddies. Thank you. Thanks, everybody.